In this video, I will discuss how to use CoQ10. Before we get started, it is important to mention there are now two commercially available forms of CoQ10: ubiquinone, the classical form, and ubiquinol, the new form. The difference between them is the newer ubiquinol form is bioidentical, the same CoQ10 form as the body naturally produces. Additionally, the classical CoQ10, ubiquinone, can occur as one of two isomers, molecules with the same chemical formula but different physical arrangements in space. The trans isomer is naturally made by animals, fish, and humans. The cis isomer does not occur naturally, but is a byproduct when CoQ10, ubiquinone, is synthetically made in the laboratory. Its effects are not clearly established, but decades of clinical use have found no problems and huge benefits. Another difference is that the conventional form, ubiquinone, is notoriously hard to absorb, and some studies have shown it produces 8 times lower blood concentrations when compared to ubiquinol. Just to give you some sort of measure, 1,200 milligrams of ubiquinone, the classic form, is equivalent to 150 milligrams of ubiquinol. But don't let this fool you. Most of the clinical studies were done with the older ubiquinone form, and you have seen how impressive the results have been. I believe it is best to get the newer form and the classical form as well, which is lower in cost, by the way. I would advise you take at least 300 milligrams of the classic ubiquinone form and 100 milligrams of the newer ubiquinol form. Ideally, take 200 milligrams of ubiquinol in 2 doses. I would advise you take as much CoQ10 as possible given your budget and pill swallowing tolerance, but do not go below the minimums: 300 milligrams per day of ubiquinone and 100 milligrams per day of ubiquinol. If you want to experience the full benefits of CoQ10 supplementation, the best type of pills to get are 100 milligram gelatinous capsules. Remember that CoQ10 in an oil base absorbs twice as well into the bloodstream as CoQ10 in powder form. Depending on the dosage you use, the maximal benefits from CoQ10 supplementation are reached after about 60 to 90 days of daily use. They also take about the same time to wear off should you stop taking CoQ10. CoQ10 in both its forms can be found in some foods, for example, chicken breast. But I think supplementation is a must because of the way our food is produced nowadays. Our food has lower and lower nutritional value, and it is tampered with quite extensively. Everything from preservatives, taste enhancers, colorings, and other food additives to hormones, antibiotics, and pesticides. Here's a tip. When you eat your meal and take your CoQ10, also add a fat emulsifier, such as soy lecithin or ox bile. For soy lecithin, just look for a lecithin product, as most lecithin products are made with soy lecithin. For ox bile, just look for a digestive enzyme that lists ox bile on the label. The digestive enzymes will also help your body unlock the energy from your meal, resulting in a double win: easier digestion and better CoQ10 absorption. In this video, you have learned how to use CoQ10, as well as some tips on getting the most out of this supplement. CoQ10 is a part of my essential nutritional supplement stack. If you want to see which are the products I personally use, then go to damianalexander.com/CoQ10. If you want to learn more about critical nutritional supplements, life extension, and disease prevention, then subscribe to my YouTube channel at Damian Alexander's Vids. Lastly, discover the easiest and shortest way to double physical and mental energy, strengthen immunity, and restore health by visiting howtochangeyourOwnbatteries.com.